Hi, Dr. Lou here. This next group of exercises or stretches for the lower body. Many times we overuse certain muscles and we don't stretch certain muscles and they become tight, and they could actually cause us to throw our back out when we go to bend over, or create chronic pulling on the lumbar spine, which will also create chronic pain. So I'd like you to do these stretches at least twice a day, morning and evening. If you don't have time to do them all, focus on the ones that are really tight, but especially do them twice a day before and after work if you can. It'll pay big dividends in getting you through your care plan more quickly, and if you'll keep them up after we discharge you, it'll help prevent your problem from coming back. This is the straight leg raise stretch. It is important to keep your hamstring and calf muscles stretched out to prevent injury and also to reduce lower back pain. So to do the test, you're going to lie comfortably on your back, have your head supported with a pillow, arms crossed over your belly if you like, knees bent. This relaxes your spine. You want to focus on feeling the stretch in these two muscles. So Angie is going to raise her leg and clasp her hands. To start the stretch, tilt the foot forward, and this is going to start the stretch in the calf muscle. And then she's going to raise her legs until she feels a nice pull and stretch, but it doesn't hurt. It's like good pain. Now you start to count in your mind 5 to 10 seconds. You got to hold it for 5 to 10 seconds to be effective, and then you relax it. We're going to repeat it 3 times, 5 to 10 second hold, and relax it. Now we're not holding the full time here for instruction purposes. After 3 repetitions with this leg, she would drop that leg down and then stretch the other side. This stretch is called the cat crawl. So let me show you how to position yourself for this. It's best to do it in bed if you can and have your feet hanging over the edge of the bed. It's not mandatory, it's just more comfortable. You can do this one on the floor or on the bed if you have a headboard, with your feet up on the bed. But it helps, this creates a little more comfort. If you have bad knees and it hurts your knees, you may not be able to do this exercise. You're just going to have to try it. But we usually recommend you do it on the bed. If you do it on the floor, you could put a rolled up towel or a pillow under your knees for some comfort. I wouldn't recommend it on a hardwood floor or a ceramic floor. So 90-degree angle here, 90-degree angle here. When I have patients demonstrate this to me, many times they show it with their arms way up here and their legs back like that. That puts more stress on your back. Come to 90 degrees here, 90 degrees here, and your back is being supported by your arms and your legs. So to do the stretch, it's very simple. You're going to let your head drop down. Go ahead and let your head, and you're going to raise your belly up towards the ceiling to create a C. Now, you don't have to get your arms and legs involved here. It's all done with your head and your back. And you're kind of opening up the spine like that. Hold that for a second or two, and then let your belly go down towards the table and raise your head up. So it's a reverse C. So you're opening and closing the spine. This is more of a mobilization exercise, and you could do 10 or 15 repetitions of this in the morning when you wake up and at night before you go to bed. So the cat crawl, Angie will demonstrate it for you a couple of times. If it hurts your knees or if it makes your back or your neck hurt, obviously we have to talk about it. It should feel good. This is the calf stretch, or sometimes called the runner stretch. For people that have tight calves, it may be playing into ankle pain, plantar fasciitis. These are some of the reasons you want to do the stretch. If you're a runner or a walker, it's a good warm-up stretch before and after you do those particular exercises. So notice Angie is standing against the wall, comfortably supported by her arms. She's standing in good posture. Now, the leg she's going to stretch for demonstration purposes is going to be the right calf. So she's going to move her left leg forward, bend her knee a little bit, and then as she kind of lunges, notice she's keeping this all straight, and she's going to take a lunge into it until she feels a very comfortable but yet strong stretch in her calf. The recommendations are always the same. 5 to 10 second hold, repeat 3 times. Now there are two heads to the calf muscle, one on the outside, one on the inside. And sometimes you need to isolate one is tighter than the other. So if you back up a little bit, Ange, if you toe in a bit, not a lot, but about 10 to 15 degrees, and then take that stretch again, if it's tight, you're going to feel that on the outside part of the calf muscle. Hold 5 to 10 seconds, repeat 3 times. Bring the leg back, toe out, not so far, right about there. And again, it's kind of a lunge on that knee, keeping this all straight and feeling the stretch now more on the inside. Clinically, I have found this one is usually not tight, this one usually is. But you'll know when you do it. You'll feel the one that's tighter, focus on that. So again, you always want to do one with the, bring your leg back, one straight in first with the toe straight towards the wall. Remember, good posture. You're not arching your back backwards. You're using your arms to let you fall into the wall. You're not pushing yourself back to get into this stretch and then maybe pinch your lower back. And now you're going to feel that stretch right down into the calf if you're doing this correctly. And then you can toe in and toe out and get all parts of your calf muscle. This stretch is called the knee to opposite shoulder. This is an important stretch to stretch the glute muscles, and it's important for patients with back pain and hip pain. It will also help to release an entrapped sciatic nerve going through the glute muscles. So here's what we're going to do. Angie is going to lift her knee. Now, if you've had knee replacement surgery or a very arthritic knee, come behind the knee like this so that you don't compress it. If that's not an issue, you can come over the top of the knee. But notice everything else is relaxed. We're going to focus on stretching the glute muscle. So Angie's going to take her knee towards this opposite shoulder, like that. And notice she's not pulling so hard that she's lifting herself off the table. She's focusing on the stretch here. Now sometimes you may also feel the stretch here if these muscles are tight. But most of the time you're going to feel it here. You're going to take it to a good stretch but not pain. Hold it for 5 to 10 seconds and repeat 3 times. So she's going to take the stretch, hold it for 5 to 10 seconds. We're not holding it that long for instruction purposes, and then release it. After 3 repetitions, she would then put this leg down and then repeat to the opposite side. Notice the knee is going towards that shoulder. You don't want to pull so hard that you're raising your shoulder up. It's very comfortable, and you're focusing the stretch right in here. This next stretch is a really important stretch for a muscle called the piriformis. It actually goes from the sacrum to the hip. Very commonly tight, and when it is, it can create hip pain, it can create back pain, it can entrap the sciatic nerve which runs through it and create leg symptoms like pain, numbness, and tingling. So to do the stretch, you lie comfortably as shown here, have your head supported so that you can relax. You want to take and cross your leg. Put your ankle at the opposite knee. Now you'll take your hand and you're going to push down until you feel that stretch. It's going to be in the butt if you're doing it right. You take it to a nice pull and stretch, good pain, but not hurting. Now if you cross your leg and you push down and you don't feel any stretch yet, that means you have some good flexibility. So to get that stretch, bring the knee up a little more and now push down, and generally you will really feel the pull. Hold it for 5 to 10 seconds as always. Repeat 3 times as always, and then you would cross the leg and do the other side. Now when you get really flexible, or if you're already very flexible and you're still not feeling the stretch, this is a more advanced version. Notice she still crossed her leg. We're going to stretch this side, but now she took her hands underneath her knee here, and she's going to pull that forward, and trust me, you will feel the stretch here. Do you feel that stretch, Ange? So again, the stretch is going to be felt mostly in here. It's always a 5 to 10 second hold, and it's always a 3 repetitions. And as always, if this stretch would make you hurt or feel worse, discontinue them until you talk to me. So this next stretch helps to stretch the psoas muscle, which is a hip flexor. Here the psoas is shortened, which happens when we sit a lot. We're going to stretch this side. I'm going to show you how to do it 3 different ways. This stretch is for if you don't have problems with your knees because you have to kneel down. Now, if you kneel on your knee and it hurts, you could also put a pillow or a folded towel down just to give your knee some support. And then basically, I'm going to put this knee forward of me. I'm going to hold on to a couch or something, a wall, something so I don't fall. And I'm basically going to just kind of go into the stretch until I start to feel a nice pull deep in here, and then lean away from it because the psoas kind of goes this way. Lean away from it till I feel a nice pull right in here. Notice what I'm not doing. I'm not arching backwards and I'm not bending forwards. As I lunge into it, I'm trying to stay over my pelvis until I get the nice pull and then pull away to give it a little extra pull. Hold for 5 to 10 seconds, repeat 3 times, and then do the other leg. Now this is a way you could stretch the psoas, hip flexor. You could put your knee on an ottoman or a chair. If it's hard to get up and down from the floor, this will help you. You can almost do it standing. If you use a chair or if you use an ottoman, maybe have a wall so you don't fall. But it's the same principle. My leg goes forward. I'm going to lunge into this until I feel that nice pull and then lean away. 5 to 10 second hold, repeat 3 times. So you might find a chair or an ottoman that you can use at home. And this is a little easier than getting down and up from the floor. One final version, if you want to, you can do it in your bed. Obviously, I wouldn't have my shoes on. And let's pretend like this is the bed. So the mattress is soft to cushion your knee. You bring this leg forward, and it's just like the one on the floor. You can lunge forward, lean away from it till you feel the nice stretch. So this may be an option if the floor is too hard for you and the pillow doesn't work. It's just another way of trying to get the exercise done for the hip flexor.